My friends, this is Dr. B, the best doctor in medicine and the most caring doctor in medicine. After more than 30 years at high level in medicine, Dr. B wants to remind you to never forget that Dr. B genuinely cares about you and Dr. B really, really loves you, and that's the reason why I went to medical school. Dr. B today wants to talk to all of you who are a certain age, men, not women. This video right here is for men who are experiencing urine dribble. As you age, like my dad, like my uncles, like many of our patients at our beautiful cardiovascular clinic, like a few of my neighbors, like a few of my friends, family members, immediately when they learn I'm a doctor, they ask me all these questions and everything, right? If you are experiencing urine dribble after a certain age, right? Because after a certain age, once you pee, it is very common to leak a little bit of urine. Now it depends, some people leak a little bit, some people leak more after they feel that they have eliminated their urine, right? A lot of us, most men actually, as we get older, our prostate enlarges, right? It becomes bigger and bigger. I'm 50 years young, right? And I finger my prostate every day to massage it. I posted a video about that. My prostate has increased a little bit. It's still pretty good. I massage it. I'm healthy, blah, blah. I have absolutely zero urinary symptoms. But I'm sure as I get older, like my dad, my older friends, patients, uncle, I'm going to experience some symptoms, right? Eventually. Only God never changes. Only God never gets anything, right? One of the major symptoms that you can experience as you get older and your prostate becomes larger is that when you pee, after you pee, you leak urine. Urine dribble, right? Many men just deal with it by taking toilet paper and wrapping their penis like my dad used to. You take toilet paper after you have peed and you wrap the head of your penis with toilet paper, and then you put it back into your underwear and you're happy until the next time you pee and you don't have to deal with anything, right? It's pretty easy to do. But if you dribble more than a little bit and it's bothering you and everything, there are two options that I have tried in my dad, my uncles, and given advice all the time, and you won't get that from urologists, except maybe a few. You will get a lot of bullshit, a lot of lies, no scientific evidence at all, but from Dr. B, no lie, no bullshit. There are two options you can take. The number one is to pee seated. Means you do like a woman and you pee by sitting on the toilet. You sit on the toilet, right? And you pee like a woman. The fact that you squat, and you can do also, like I do when I poop, I have a little stool by the side of my toilet seat, and I bring it close, and I pee with my legs, my knees completely bent like that. So I'm falling down the toilet seat, and this opens my rectum, opens nicely and allows me to poop and empty almost completely my rectum, right? So pee by sitting like a woman on the toilet seat, and if you can, go online, buy for $5, right, a plastic, beautiful, mine is wood, nice beautiful wood, nice beautiful, beside my toilet seat. And put it under your legs, bring it close to your legs so that you're sitting on the toilet seat with your knees and hips completely bent. And this position will allow you to pee and empty your bladder way more than if you were to pee standing. Therefore, after you have peed and you get up, you will no longer dribble. And that has proven to work extremely good with my dad and with my uncles. But eventually, over time, the prostate, some of them gets larger, they have to have resections, blah, 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 blah. I don't want to go too much in the details, right? But if your dribble, urine dribble after you pee, bothers you enough that it's not enough, like initially my dad used to put this toilet paper around the tip of his penis and then put it in the pants. If it bothers you, then do what I just said, squat completely and pee by sitting on your toilet seat like a woman, and then buy a stool, plastic or beautiful stool, put it on your feet to lift your hip, bend more your hips and your knees towards like that, and then you can pee and empty a lot your bladder. Just that will solve a lot of your problems. Not all of you, but everybody is different. You have nothing to lose, just $5 to buy a stool and leave it at beside your toilet seat and to start peeing like a woman. That's it. And nobody's going to see. Just close the door. Everybody's going to think that you are peeing still like a man. Don't be ashamed of that. There's no shame at all, right? I can pee seated. I pee standing. I don't need because I don't have any dribble. But try it. I swear to God, it might help you a lot, like it helped my dad, my uncles, and a lot of patients to whom I give this advice for many years, right? Another option, if it helps you a little bit, to sit while you pee, because it allows you to empty a lot your bladder. But if it doesn't solve it completely, another option is, where did I put it? There you go. For those of you who are on tamsulosin, my apologies, 0.5 milligram per day, right? Tamsulosin is a very common medication. It's an alpha blocker. My dad used to take it. My uncle, millions of people all over the world are taking this. People, men who have benign prostate hypertrophy, enlargement of their prostate. It allows them to pee, to empty better their prostate, right? Their urine. By taking tamsulosin earlier than later, you will be able to empty your bladder way more than if you were not taking tamsulosin. And it's a medication with extremely low side effects at this dosage, 0.4 milligrams per day. Very, very, very low side effects. So if sitting on the toilet seat, squatting on the toilet seat, doesn't help you to get rid completely of this urine dribble, then ask your doctor if it's not the time to also start taking tamsulosin. This will open way more your bladder's urethra, the pee duct that goes from your bladder to the outside through your penis, and will allow you to pee way easier than if you were not on tamsulosin. And because you're going to empty your whole bladder, almost all of it, there's not going to be anything left for you to then have urine dribble and constantly bother you, right? So remember, if you are bothered with this and you have benign prostate hypertrophy, enlargement, and you are bothered by this urine dribble, start squatting. Pee like a woman, buy a stool, $5, put it beside your toilet seat. And try it for a few days and see how it works. Remember, everybody is different. You don't know how long it's going to take for you to get used to it, for you to feel comfortable with it, right? Do you understand what I'm saying? And everybody's different. It's going to work on this guy. It doesn't work on that one. But for me, in my own experience, in my family, friends, and patients, it has worked pretty good. And then if it still doesn't work, See if your doctor wants to prescribe you this. This is going to allow you to really empty a lot your bladder and to make it easier for you to pee. You won't have to push anymore as you used to before. But remember, always ask your doctor. I am not your doctor. I am here to bring you my expert, scientifically based expert opinion after 30 years in medicine, but I'm not your doctor. Only your doctor can prescribe you this. But in a lot of my family members and friends and patients, this has worked pretty good with extremely low side effect. But again, it's better to delay as much as possible taking medications. And going the natural way means start by squatting and sitting like a woman when you pee. I love you guys regardless of your gender, ethnicity, color of your skin, political affiliation, religion, blah, 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 Hindu, Muslim, atheist, independent, Democrat, Republican, man, woman, anything in between. I love you. That's why I went to medical school. I took the Hippocratic oath to never betray you, to never put my interest above yours. You will always be above me. I love you. Put your question, your comment, any katso you want to ask down there. I promise I will get back to you as soon as I have the time in my busy but beautiful life. Kopkun nakrab, sawadee krab. Talk to you next time in the next video. Bye-bye.